Hello, ladies and gentlemen. Welcome to the backstory. If you are new here, kindly hit the subscribe button and the notification bell down below so that you can be notified when we post a new video. Now, ladies and gentlemen, the Kenya Kwanza administration has two pet projects that they want to implement by any means possible. One of them is the shifting from NHIF to SHIF. Apparently, SHIF is supposed to start operation at the end of this month, where the employed will be deducted 2.7% of their gross income. Now, when such policies are being made, the ideal situation should be public participation, then it moves to parliament and all that. But in this one, the laws that are supposed to govern or to operationalize the shift from NHIF to SHIF has already been passed, but public participation is currently happening. Now, Kenya Kwanza administration, in its characteristic nature, has not consulted widely so that they get input of those who are affected, like the counties. Remember, health is a devolved function. So if there are problems with NHIF, some of the stakeholders that needed to have been consulted include county governments, professionals within the health sector, which is KNPDU and all that. So it seems like the Kenya Kwanza administration has not consulted widely. It has not consulted county governments. And that is why Murang'a County Governor, who is IRUNGU Kenyatta, has come out to highlight some of the areas that he thinks the Kenya Kwanza administration or the Ministry of Health needs to look at as they try to improve or to shift from NHIF to SHIF. So in the letter that was published in his weekly article that he writes to the Sunday Nation, Governor IRUNGU Kenyatta has pointed out some of the issues that he thinks that the Kenya Kwanza administration needs to look. And the headline of that article that is written goes as how to make a new health scheme better. How to make new health scheme better. So the new health scheme that is talking about here is the SHIF, which is Social Health Insurance Fund, which the Kenya Kwanza administration wants to operationalize. So if you look at some of the issues that IRUNGU Kenyatta, I think, has highlighted, these are issues that I don't know how the Kenya Kwanza administration overlooked. So the main idea behind SHIF, as IRUNGU Kenyatta has highlighted, or as the idea is trying to push, is for Kenyans to be able to access free healthcare services. And the idea is to rope in people in the informal sector into this scheme so that there could be enhanced revenue that is used for the improvement of health services. But the question that Kenyans are asking, or IRUNGU Kenyatta has asked here, is how is the government going to implement roping in of the informal sector into this scheme? Before we get into the areas that IRUNGU Kenyatta has highlighted, we have to look at NHIF. NHIF used to get revenue from three different sources. The first source was contribution from the formal sector. Then the second one was contributions from the informal sector, whereby individuals used to contribute 500 shillings to the kitty. And then after getting that, they would get the standard benefits package. That is the basic package from NHIF. The county governments still would pay for a package which was called enhanced package. Enhanced package was for county employees, whereby county employees like doctors and all that, they would get a kind of a comprehensive package for their employees. The total contribution from counties and other areas like development partners that used to sponsor Edu Afya and all that, NHIF itself could get close to 40 billion shillings. So now let's go back to IRUNGU Kenyatta's concerns and areas that he thinks that needs to be looked at by the Kenya Kwanza administration. One, Irungu Kang'ata is asking a very important question here, that how is this shift going to factor in enhanced scheme? Because apparently under the shift, this enhanced scheme by the county governments is going to be abolished. Edu Afya, which was taking care of school-going children, is also going to be abolished under the shift. So one question that Irungu Kang'ata is asking is, because under the enhanced scheme, these county employees would get other services like dental cover. There was the dental cover, there was optical cover, and other small packages here and there within the comprehensive package. So this has been abolished. The question that Irungu Kang'ata is asking is, how is this going to be taken care of? So the Kenya Kwanza administration or the Ministry of Health need to come up with an inclusive way of factoring in some of the issues that he has highlighted there. Then the second issue is on revenue collection. Revenue collection, Irungu Kang'ata has talked about the contribution that was being given by the county governments. Then the assumption that Chief is making here is that they are going to get a lot of money. That revenue is going to be moved from around 3 billion Kenya shillings to around 90 billion if the informal sector is roped in into Chief. But the question that is asked here is, how are they going to operationalize this? Because one, if you look at how Kenyans behave, or if you look at how Kenyans accessed NHIF, Kenyans would only use NHIF on a need basis. There are guys who could take close to 2 years without paying for that NHIF. But when they get into a medical condition, that is when they pay, or pay a lump sum. After they are treated and now they are done with that issue, they forget about NHIF. So Kenya Kwanza, in their own thinking, are talking about denying Kenyan services. Kenyans who do not pay for the 300 shillings or whatever amount of money, they are denied services. So the main question here is, how are they going to implement this? For the formal sector, it is going to be a little bit easy because there is a structured way of collecting revenue from collecting that percentage that they've levied on the informal sector. There's a kind of a formal way, but the challenge comes when it comes to implementation of collection from the informal sector. That is where they might miss the target. However cheap that service could be. How many Kenyans are going to buy into the idea, and how sustainable is it going to be? Because for Kenyans in the informal sector, they look at it like, why should I pay 300 shillings every month when I can pay for something when I need it? So to Kenyans, it's always on paying on a need basis. So Kenya Kwanza might miss their targets, which is 90 billion that they were thinking about. And secondly, they are also going to miss on the revenue that was being contributed by the county government. That's another 40 billion shillings. County governments and other development partners. That is close to 40 billion shillings. So they are looking at raising 90 billion, which they are not assured of, but foregoing like around 40 or 45 billion shillings that they were assured of from the county governments and other development partners. So that is an issue that needs to be looked at, and I think Kenya Kwanza or whoever is handling this needs to look at it. The third issue that Irungu Kang'ata has highlighted here is medical sector supply. That is another very, very serious issue that needs to be looked at. Because one, if you're going to rope in 45 million Kenyans into this cover, it means you've told them that they are going to get free medical services. So whoever or anyone who used to go to these what we call pharmacies and all that, buy drugs, then go back home or go to private hospitals, will now be motivated to go to public hospitals. So it means that if you are serving like around 200 patients in a day, ideally you will now be expected to serve close to 500 patients in a day. So if you're going to handle those 500 patients, has the Kenya Kwanza administration factored in the fact that they need more nurses? Have they factored in the fact that they need more doctors? They need clinicians. How has that been taken care of? Because KANG'ATA has given an example of Muranga Level 5 Hospital. It's given an example here that Muranga Level 5 Hospital, before the introduction of NHIF, before the introduction of that enhanced scheme that they were providing for Muranga residents, they used to do like around 700 patients in a day. But after the introduction of enhanced scheme, they started handling 1,500. It's like double the number. So in such a situation, what they did was to expand Muranga Level 5 Hospital. They've tried to expand other facilities within Muranga County so as to take care of the increased number of patients. We are looking at 45 million Kenyans being roped into this scheme. How are they going to handle matters to do with human resource? Are they prepared for this, or are they just looking at the amount of money that they're expecting to raise? Have they looked at that? Then let alone human resource. Are our facilities able to handle the pressure that is coming with increased access to Medicare? Then the other issue that he has also talked about is representation in claims. Apparently, the Kenya Kwanza administration has outsourced the company that is going to handle claims. And they were talking of giving it to a private insurance company. So for the private insurance company, they will deal with those hospitals that are going to claim for repayment or reimbursement of whatever they have used within the month. So the challenge that is coming up here is, how are they going to handle claims from county governments? How are they going to handle claims from public hospitals, and how are they going to handle claims from private hospitals as well? NHIF and county governments used to have like a government-to-government arrangement, but when it comes to now having a private insurance company handling claims, are they going to have representatives from the public hospitals or from the county governments who are going to like handle issues to do with the counties? So that is something that the Kenya Kwanza administration or the Minister of Health needs to also look at. The last one is matters to do with employment. Because if you are to do shift, there's going to be a lot of pressure. So employment of staff, is it going to be done by the county government, or is it going to be done by the national government? And our county governments, do they have enough funds to handle the issue of employment? Because you expect that with the increase in the number of patients visiting our hospitals, you'll need to, just as I said, you need to get nurses, you need to get doctors, you need to get clinicians, you need to get, you need to get all staff that are needed in these hospitals. You need to get numbers. So who is going to handle this? Is it going to be done by the county governments, or is it going to be done by the national government? And do we have funds to do that? Or are we going to depend on money that is contributed by members of the public into shift? And how sustainable is that? So I think these are issues that the Kenya Kwanza administration or the Ministry of Health need to look at seriously before we transition into shift, or else this is going to be another chaotic kind of scheme. So all this, it gets me back to what I was talking about. The Kenya Kwanza administration needs to be working on public participation first. Try and involve stakeholders within that ministry so that they give you their opinion and how you can improve. the fact that you're seeking opinion does not mean that they know better. They might know better than what you bringing in, because this is a new idea. But these guys have institutional memories. They have had their own challenges. They already know ways in which this new kind of system can be improved so that Kenyans can access the best services. So for me, it's a failure by the Kenya Kwanza administration. I think it's the same issue that the same problem that they're having with the housing fund or the housing levy, whereby instead of doing public participation, instead of roping in Kenyans into the idea, carrying Kenyans along with the idea so that they buy into the idea, the Kenya Kwanza administration believes that whatever idea that they have come up with has to be implemented as is without being questioned. So it's something that maybe we can forgive them because they are just 1 year into governance. But I think they have policy experts that need to advise them on how to do some of these things. So this is something that I know there are so many people within Kenya Kwanza administration are not feeling comfortable with how IRUNGU Kenyatta has raised this issue. But I think IRUNGU Kenyatta is a professional, he understands, he's a lawyer, he's a governor. I think within this time he's heard and seen some of the challenges. So to me, I think the Kenya Kwanza administration needs to rope in all the stakeholders into implementing shift. So ladies and gentlemen, that is it from me to today. Until next time, bye-bye.